sleep disorders. These 5 will come under dysomnia. And in parasomnias, nightmare disorder, sleep terror disorder, sleepwalking disorder. So these 3 things coming under parasomnias. My voice is clear?
Yes, sir.
Okay.
Good afternoon, sir.
Good afternoon.
We can hear. Yeah.
Okay. So, what is insomnia? Insomnia is a condition, difficulty falling in sleep. People face difficulty to go to sleep. Even though if they've fallen into sleep, maintaining sleep is a difficulty. So this condition will be called insomnia. And the other condition is hypersomnia. This hypersomnia condition, people will have excess sleeping during day. So what will happen if they follow in daytime sleeping? Daytime they sleep and nighttime also they sleep. These people will sleep more hours than required. This is another condition. And the third condition is, under dysomnia, the third condition is narcolepsy. In narcolepsy condition, people will go to sleep suddenly. Normally for going sleep, we have to go to bed and we have to lie on the bed, we have to sleep. But here what will happen? It will happen suddenly. Even in the class also, somebody is there, suddenly they go to sleep. Suppose if it is in driving, the person is in driving condition. Suppose if you go to sudden sleep, like with narcolepsy condition, there are more chances for becoming accidents. And the other condition, the fourth condition is sleep apnea. These people will have sleep disruptions, particularly sleep disruptions because of respiratory problem. Taking of air is a problem. So the disruptions in air taking, the difficulty in breathing problem will cause the disruptions. So this is also a condition. Normally this will happen for many children also. Nowadays for this treatment is also available for this. What will happen for these people? Air blockage will happen. Because of air blockages, though the airflow is not continuous, some disruption will happen. This will create disturbance for the sleep. So this condition will be called sleep apnea. And another condition is, tell me. Somebody. Okay.
Excuse me, sir. Sir,
Yes.
sir, we get sounds while they sleep, sir. Because of this breathing related sleep order, they make sounds, sir.
That means snoring you are
గురక
saying?
పెట్టడం అంటుంటాం కదా మనము గురక పెడతారు కదా సార్.
No. Snoring is different somewhat. These conditions are different.
Okay.
Snoring is different from sleep apnea. Okay?
Okay, okay, sir.
Next condition is circadian rhythm sleep disorder. See, daily, normally we sleep some particular time, 10 o'clock or 11 o'clock. we will get up in the morning 6 or 6:30. That is a generally followed circadian rhythm to our body. Suppose if you sleep one day at 10 o'clock, get up morning at 6 o'clock, and the other day you sleep at night 2 o'clock, and now you will get up morning at 8 or 9. That means our body, the biological clock, is getting disturbed. Because of this disturbance, we don't have proper sleep. And falling into sleep is also somewhat difficult because we are disturbing the timings. The circadian rhythm in our body, the biological clock is getting disturbed. So this condition also will create some sleep problems. So these are the insomnia, hypersomnia, narcolepsy, and sleep apnea, and the circadian rhythm sleep disorders, all the conditions coming under the heading of dysomnias. One of the sleeping disorder conditions, dysomnia. And the other condition is parasomnias. In parasomnias, what will happen? In the sleep, even children or elders also sometimes they will get dreams. In the dream, some frightening dreams will come. That means fearful, some threatening type. Suddenly they will wake up and they will cry, and because of this, the sleep will get disturbed. And the second condition is sleep terror. This is like a nightmare disorder only, but this is more intense when compared to nightmare disorder. Here also the effect will be because of dream only, but the dream, the frightening intensity is somewhat severe here. So because of that, the terror will happen in the sleep. So the
Sir,
terrorness will.
sleepwalking disorder comes under, sir?
We have not gone to sleepwalking. We are discussing nightmare and sleeping terror disorder. And sleepwalking is different. That is third condition in parasomnia. What they do in the sleep, in the deep sleep, particularly when they are in deep sleep, that means almost they are in REM sleep. Suddenly they will wake up from the bed, they start walking. Sometimes this type of things will cause even accidents also. In that time, remaining all the people in the house, they are all sleeping. Only this person will get up from the bed when he is in deep sleep. He will stop walking by closing eyes only. You don't see also even. So there is a chance for even becoming accident also. So these three conditions are coming under parasomnias. So totally there are 8 sleeping disorder conditions, 5 under dysomnia, 3 under parasomnia. So we are all discussing sleeping disorders, but we are all qualified psychologists in future. But our main duty, our main responsibility is how to overcome all these problems. Now we are just learning what are the sleeping disorders, what are the causes for sleeping disorders. We are all studying. But after becoming a MSc qualified psychologist, if somebody approaches you, how you help them to manage their condition is important. As a psychologist, you should know the role of psychologist, how to deal these type of sleeping disorders is very, very important for you. So, being some knowledgeable person, being a counselor, if somebody approaches you, you have to give some suggestion for them. The first suggestion is you have to ask them to maintain a record how you are sleeping, what time you are sleeping, what time you are waking up. So the sleep pattern is daily, at same time is happening, almost half an hour difference, plus or minus, or it is becoming erratic, that means circadian rhythm, that means biological clock, whether they are having any disturbance. So these type of conditions we have to observe. For observing all these things, we have to ask the client to have some record, sleeping record he has to maintain. Then only we will come to know the sleeping disorder is causing because of biological clock disturbance or any other disturbance, or is house environment difference also sometimes. If the house
Sir,
environment,
excuse me, sir. Nowadays, smartwatches are recording sleeping conditions. Are those useful to maintain sleeping records, sir?
sir, your brain is more powerful record than any other thing.
Okay.
Suppose if somebody comes to you, the
Okay.
some person is having that type of watch or not is a different thing.
Okay.
But when we are dealing with the client, at least the person also should know the importance of the time, what when he is sleeping, or he is having any different schedules on day by day, whether he is having biological clock disturbance or not. The importance of biological clock also we have to inform to him. That is very much important.
Okay,
The
sir.
lag should not come in the sleeping pattern cycles. That is very, very important.
Okay, thank you, sir.
And the other condition is people just before sleeping, some people watch TVs. Some people watch screens, YouTubes, all these things.
Web series.
So what will happen? The radiation, what it is creating, TV screen or even mobile phones, will have some effect on your retina. So it won't allow you to sleep properly within the time. So we have to advise to the client, at least night time, after just before 2 hours sleep, avoid all these things. Looking screens, TVs, all these things, better to avoid to have a good sleep. These things will create some effect on our sleep patterns. So we have to create some self-control within the person. That is more important. One minute. Okay, sir. Sorry for the disturbance. So this is the another suggestion as a psychologist you can prefer. And the bedroom condition is also important. Where we are sleeping, we should not have much disturbance surrounding areas. Suppose we went for sleep, we lied on the bed, somebody is creating some noise, or somebody is switching on and switching off lights. So the lighting also will create some disturbance. Yesterday I told you, in our brain, the pineal gland will absorb the light through eyes. So when you want to sleep means the melatonin hormone production is very important. The melatonin hormone will produce when the surroundings are dark. So the melatonin hormone production is important. To have good production of melatonin hormone, we should create somewhat dark area. The light should not be so bright. A small bed lamp is sufficient. And bedroom should be somewhat cool. In some conditions, particularly in summer type of conditions, we cannot expect everybody is having air condition, all these things. Ultimately, the comfortable conditions we have to create where we are sleeping, whether it is sound or lighting or room temperature, all these things also will play a role not to have sleep disturbances. And in recent days, nowadays, many people are suggesting, even I am also suggesting, suppose if we have any disturbance in thought process before going into bed, we should practice relaxation techniques. Jacobson relaxation techniques. So that also will reduce your anxiety levels. If anything, anxiety you are feeling before going to bed, but we should not sleep as it is. So we have to bring down the stressful condition or anxiety condition before going to bed. We know all the information when we have a case history taking from the client and taking interview and is regularly the behavior before sleeping, how he is doing all these things, then only we will come to know we can have a better suggestions to the people, those who are coming to us with sleeping disorder problems. So every psychologist, just finding out the problem is not the solution. Many people will say the reasons, but we are the qualified people. We have to suggest how to overcome this type of sleeping disorders is very, very important. Okay, I hope with this we completed sleeping disorders also. So anybody want to interact about sleeping disorders, please, 2 minutes. Anybody?
Sir, is there
Please.
any treatment for narcolepsy, sir?
Yeah. For narcolepsy treatment, as a psychologist, only we can refer the child to a sleep clinic.
Okay. Okay.
But we can't do as a psychologist anything. Somebody will go even for surgery also, because the air passages blockages. How to avoid all these things? Only the sleep clinic doctor only will take care of it.
Okay. Okay, sir. Thank you.
Because my grandson is having this sleep apnea.
Okay.
I have got bitter experience with this sleep apnea. I went to a sleep clinic when I was in Australia also. They have done a lot of sleeping pattern studies. So they studied him. They told some surgery may require in future. They told like that.
Okay, sir. Okay.
But
Thank
still,
you.
my grandson is suffering with that sleep apnea, but he is unable to sleep in the night properly. He will get body sweating. He will get disturbance in the sleep. The problem still we are having.
What is the difference between OSA and CSA? There is something called obstructive and central.
What, sir? I'm not sure.
In sleep apnea, there are two categories, OSA and CSA. Obstructive and the other is central. So I understand obstructive is that your air pathways are blocked. How does the CSA manifest, and could you throw some light on it?
No idea, sir, for this. Because these are all medical conditions. See, all conditions we cannot provide solutions, because we are not having expertise in those areas. Only medical people only will attend all these things. As a subject known person, briefly, we can refer the client who is suffering with sleep apnea, and we should have knowledge. His condition is whether it is a sleep apnea or some other condition. That much knowledge is sufficient as a psychologist for us.
All right.
Okay, sir.
Yeah, thank you.
Hello, sir. Hello.
Sir, excuse
Please.
me, sir. Sir, this sleep order that may continue till their adulthood also, sir.
Sleep order or sleep
Walking sleep.
apnea?
వాకింగ్ స్లీప్ సార్, వాకింగ్ స్లీప్ అనేది వాళ్ళు టిల్ దేర్ అడల్ట్హుడ్ వరకు వచ్చేంత వరకు కూడా కంటిన్యూ ఉంటుందా సార్, లేదంటే దీనికి ఏమైనా ట్రీట్మెంట్ ఉంటుందా సార్?
కొంతమంది పెద్దవాళ్ళకు కూడా ఉంటుంది కదా.
The treatment ఉండదా సార్? They don't get any treatment for that?
See, we have to go, instead of treatment, it is better to go for cognitive behavior therapy for them. Because the dreams only is creating disturbance for them. Something is running in their mind. So before sleeping, before going to bed, we should have some peacefulness. Somebody is feeling some anxiety, some stress conditions. Same thing will run when they are sleeping also. So they start doing some actions also just by waking up.
Okay, sir. Thank you, sir.
Hello, sir.
Please.
According to the sleeping disorders, bedwetting is also the problem, sir.
No. Bedwetting is an anxiety condition. Bedwetting is an anxiety condition.
How can we solve this, sir?
Bedwetting?
Yes, sir.
We have to reduce the anxiety, no? Normally, it will happen for childs only up to 15 years. Also, some children are having this type of anxiety issues, particularly.
Sir.
Thumb sucking, bedwetting, these are the conditions normally many parents will not accept. So this is related to anxiety condition. We have to give some therapies to reduce their anxiety.
Any medical treatment is there, sir, or any psychological problem?
Mostly psychological, but we cannot rule out some medical conditions also. We have to take the advice of medical doctors.
Okay, sir. Thank you, sir.
Okay.
Sir, what kind of condition I have? Every day I make a plan to go for a morning walk or something, but I don't get sleep entire night. But at the time of 4 or 5, then only I go for a sleep. Next day I also plan, but I don't get sleep entire night. So I used to watch.
What is your profession? What is your profession?
Profession. Right now I'm not doing anything. Previously I was doing a job. That's it.
Okay, in the class I cannot discuss elaborately for each and every condition. If you have any personal issues and all, you please consult some professional.
Okay, but it comes under which condition? So I'm getting little idea.
No, you take the advice of some professional. No? Otherwise, you come to me, I will also suggest you. But in the class, we cannot go so much elaborate about all the conditions.
Okay. See, I was not asking individually this solution. I was just little asking the direction in which direction.
No, actually, I'm not understanding what you are saying also. Some disturbance.
Okay, no problem. I'll discuss with you, okay?
Hello, sir.
Ah.
Some people early to sleep 9 o'clock, but 3 o'clock wake up, no sleeping. What is the problem, sir?
9 o'clock sleeping and 3 o'clock waking up. After that, they don't sleep, huh?
Yes, sir.
So they might have some disturbance in the sleep because of nightmare or night terror, or they feel sleep is sufficient. If it is happening regularly, means we have to study. It is happening for elders or
elders, sir.
Elders normally they wake up early because their biological system will get some effect in sleeping problems, in sleeping patterns. That we are going to discuss in our next class. Today only we are going to that class.
Okay, sir. Okay, sir.
Okay, we are concluding this sleeping disorders, and we are going to the next class, unit number 13, aging and psychological disorders. Aging. Everybody will become aged, no?
Okay.
Okay. Now everybody is visible. Seeing this slide.
Yes, sir.
Very good.
Sir, visible.
Okay. So mental health and aging. For aged people, why their mental health is getting affected for some people particularly. The topic we are going to discuss in this subject. So, just to understand the mental health and age relations, you go through this para. Mental health is important at every stage of life. Correct, no? Mental health is important at every stage of life, and it includes emotional, psychological, and social well-being. Mental health means all these three conditions. Emotionally, we should feel healthy. Psychologically, we should feel healthy, and social also. Then only we have healthy conditions, not only in old age, even in our adult age also. Normally, people becoming aged. Everybody is becoming aged now. 30 years, 40 years, 50, 60, 70, like that. We are just having a process in our life. We will experience some changes in mental health conditions. Suppose somebody, our loved one, has passed away, or some serious ill healthness is there, one of our family member. So naturally, we feel some disturbance. Emotionally, we will have some disturbance. So if the illness is continuing for more days, what will happen? For aged people particularly, because the aged people are advisors to us, the caretakers, and the well-wishers for us. So emotionally, they will have some distress. Psychologically also, they will get some disturbance. But we should know how to have coping from these conditions. But certain things we cannot avoid, no? Definitely somebody will die after some age. Somebody will get some illness. Certain things is not in our control. But people cannot accept all these conditions. When people don't unable to accept such real conditions, continuously they will suffer. They will have grief. They are unable to come out from the grief. So, in those conditions, their mental health will get some effect. So, this will not happen for everybody. Some people will have better coping strategies. Some people unable to cope with the prevailing situations. If the mental health is not correct for particularly in old age, for elderly people, they will face some difficulties in their day-to-day functioning. suppose if they are having this type of feelings continuously, these conditions will make them to lead some mentally ill health conditions. For example, they may depress, they may feel anxious. So these conditions we are also seeing. The elderly people worrying continuously, feeling some anxiety. What happened to my son? He is far away place. But okay, he is in far away place. Can he do anything from here? No. You know the reality, but the suffering is there. So as a family member, other family members, at least they should recognize, they should identify the symptoms and signs of the elderly people, those who are living with us in our house. We should provide some care to them. If necessary, we should take them to a professional also, mental health professional, to improve their mental health conditions. So this is very important for particularly when the people will becoming aged, they will have some mentally ill health conditions. Identification is very important, and taking necessary help from professionals is also very important. So that thing only we are discussing in this chapter. So see the causes and risk factors for mental illness in elderly in India. Not only in India, it is common in every country. Please tell me.
Sir, I have a small doubt, sir.
Hmm.
The few members in old age, not old, but they will do a bedridden. Mental illness or any other issues are added in this, sir?
Yes, they are only bedridden. They are unable to come out from the house. Correct, no?
We can say that it is due to mental illness or due to their old age or any other issues.
See, when they are unable to come out means their physical conditions are not cooperating to come out. One thing. Suppose somebody is because of his medical conditions, he is bedridden means normally people they feel loneliness. So the loneliness continuously is continuing means definitely people will get depressed. No? Somebody should talk to him. Somebody create some motivation to the peoples. So we have to follow some rehabilitation procedures. See, one example I will say, Amma. Suppose somebody is in hospital. Doctors are providing very good medical conditions, very good treatment is going on. But even though all relatives and friends go to the hospital, they will talk to the patient. So here what will happen? The patient's mental health will improve because of the emotional connect what he is getting from friends and family members. So his health condition is getting improved not only because of medications. His emotional health also improving. Suppose he is lying in hospital, nobody gone to hospital except doctors. So he feel isolated, loneliness. Emotionally, he was not supported. Understood, Amma? Please respond. Understood?
Yes, sir.
Yes, sir.
Yes, sir.
So even though elderly people in our
Yes,
house
sir.
or in our community having also, they should have good socialization, good support. Even though they are on the bed also, they should not feel isolated.
Sir, if the
Only
same problem with a child and a grown-up kid, if it is the same problem with a child and a grown-up kid.
no, I am not following what you are asking.
So if the same thing is happening to the child and a grown up child.
Yeah, it is a parent's problem. Parents has to provide a good support to the children. Emotionally, parents has to support. Only parents' duty is not to give a good education, not to give good clothes and good facilities. Emotionally, parents has to support the children. Whenever children are having some difficulties, at least parents should have time to listen their concerns, and parents can able to spend some of the time with children. Then only children will not have any isolated feelings and emotionally disconnected feelings. But most of the parents are doing this, but some parents are not doing because of their busy life. So children definitely they will depress. Their mental condition will get affect because they have comparison with other children's, how other children's parents they are supporting, how my parents are behaving like this. So this emotionally, this is called emotional abuse. Not only alcoholic abuse, not only physical abuse, emotional abuse also is there for children. We should not create emotional abuse. Clear, Amma?
Okay, sir. Thank you very much.
Sir,
Next.
one more doubt, sir. One more doubt.
Hmm.
Aged people, they feel some insecurity while they want to come, they wish to come outside and all at that time. What is the reason? Most of
Insecurity
the
means
people
because
observed.
of the insecurity means because of their physical condition not cooperating.
Okay, sir.
Sir, you said lonely people are get depressed, but sometimes I have seen some people feel good when they are not lonely, like spiritual people. So why it is difference in the
See,
mindset?
because spiritual people means they are engaged. They are engaged even though they are alone in the house. They are busy. They are reading books. They are spending time in good manner. They are talking to their friends. So that means they are not disconnected from the society. Even though they are in the house, they are maintaining good relations.
Okay, okay. That means technically they are doing something. They are indulging something. They are also not. Okay, okay.
Okay, we are going for causes and risk factors for mental illness in elderly people. Okay. Normally, when people becoming, some physiological changes will come in the elderly people that everybody is seeing, everybody has to accept. But the psychosocial conditions should not get disturbed. Elderly people, even though they are staying in the house, they are not going out much of the time. But socially, people should have connected. They should not have disconnection. By staying in the house also, many people are there, enjoy their life very happily. The type of conditions they have to create, even the family members also accept for this type of conditions. Normally for old age people, the elderly people, because of their physiological conditions, degeneration is happening in the brain. When we become elderly people, in the brain also, the neurological system in the brain will start degeneration. The neurons in the brain will degenerate. So the cognitive functions particularly will come down. What we are having cognitive ability in the age of 45, 50, 60, the same conditions they may not have when they become above 75, 80 years. So because these mental health conditions, why it is getting developed in the old age people, I am going to give some examples to you. Just please concentrate. The first condition, urbanization and westernization. play a major role in the increasing migration of the younger generation, leading to weakening of the social structure. That means we are staying in India. Our children's gone to somewhere outside Australia, America, New Zealand, somewhere. What is the feeling of the parents? Not everybody. Some people are happy, even though their children's staying abroad also, they are very happy. But some people, younger generation, gone away from the home country. So what is happening? The social structure in the family is getting somewhat weakening. And particularly the traditional values, the present generation is thinking very happily, even though when they are in outside countries. But the people traditionally, the present generation having 80 years, 85 years, emotionally what they are feeling, my son is somewhere, my daughter is somewhere, if something happened to me, who is there? Even though their son, daughter providing very good facilities here, they kept some maid also in the house. They provided some helping person also in this house. But even though the people are happy, the old generation people are having more emotional attachments. Here the problem is attachment. The people, they don't know the detachment. Daily their son, daughter, they cannot come to India and they cannot spend some time with the elders. But emotionally, they are unable to detach. So in that condition, even though they are having all the facilities in the house, emotionally, they feel down. They will depress. This is happening because of urbanization and westernization. But we can't avoid this. Only what we should know is, we should know the detachment. Our children are grown children. For their development, they have to go somewhere. We should not have this much emotionally connected with them. But okay, nowadays many people are adjusted because on YouTube or even phone video calls, they are all talking some insecurity, they are not having reduced. But some people still, the traditional people still having this type of problems. The elders are becoming sick and emotionally disconnected, feeling anxiety and depressions. Agreed?
Yes, sir.
Okay. Next condition, you see, older adults have to undergo major changes in their lifestyle, and inability to accept and adjust to their changes is one of the important cause of the increasing prevalence of mental illness. What it says, the lifestyle changes, particularly inability to accept and adjust to these changes. Some people are unable to adjust, adapt to the lifestyle changes. They are also having some ill health, mentally feeling always lowness and sickness. And particularly, this will happen with people with retired people. See, when we are in a young age, 50 years or 55 years, our children not completed their marriages. That time we are having so much authority, we can decide everything, they have to follow. Once they become elders, they married, they have their own families. Even though the elderly people, some people have command on the children, you do like this, you do like this, you follow like this. But some children will not accept. Hi dad, we have become grown-up children, so now we married, We have a lot of ideas. We want to do like this. So some disagreement will happen between the aged people and younger people. In that situations also, some people unable to adjust this type of conditions. Definitely, they feel isolated and neglected. Their identification has gone down in the family. So they are going to feel continuously. So here the psychologist responsibility is we have to talk to the people what changes they need to make in their mind, in their thinking. We have to explain. We have to see. They have to understand the situations, present generation situations. Then only they will have some peace. Then only they will change their thought process, their thinking process. If they got change in their thinking process, then only they feel somewhat happy. No depressive conditions. And next, old age is characterized by multiple losses in terms of loss of physical and mental capacities, loss of loved ones, loss of authority, importance. Naturally, the elderly people will lose some authority in the house, what we discussed previously also, and then some importance also. Earlier, their sons will have a consultation with the father for even small matters also, for the advice. Now, son has become elder, good adult, he can do everything on his own. Nowadays, he is not taking the elderly people opinions. But some people will understand. My son has become capable person. Let him take his own decisions. He did not consult for each and everything. But some people, I was neglected. I lost my authority. I lost my importance in the family. So thinking in the negative way, they are inviting ill health conditions mentally. Their psychological condition most of the time getting disturbed because of this illogical thinking. So as a psychologist, you have to educate the people the way how they have to think to have mental health. And fourth condition, any physical illness leading to loss of mobility and dependency can lead to elderly depression. Suppose some sick person is there, he is unable to go out. That means loss of mobility. And he is most of the time is depending on family members to go to washroom, even going for bath. Some people are there. So most of the time they are on the bed only. So why this condition happened to me? Why I am unable to move outside? I am totally dependent on my children's. This is creating a lot of pain to me. So that type of feeling also will create continuously depression. There also a psychologist go and talk to the people and advise the family members also what type of changes they have to do in the family to keep elderly happy, even though the persons are not having mobility. And by talking to the people and listening to their concerns, so definitely elderly will feel some happy. They will come out from depressions. The last condition is loss of loved ones can lead to loneliness and isolation. See, once the person become 80 years, his spouse, either wife or husband, may lose, may die. As long as, even though elderly people, there too, they have some daily discussions, talking each other, they have some company. Once a person lost, either wife or husband die in elderly families, definitely it is very pathetic situation, very painful situations. They feel very lonely, isolated. So this type of people also will have a lot of sickness mentally. But all these conditions we are discussing, but as a psychologist, who should have good help and guidance to those people, those who are having this type of sufferings. We have to make them to accept their conditions first. So what betterment they can do from the house, from the family members, the type of suggestions we have to do necessary counseling for the family members, even for the elderly people also, to come out from that sickness, mentally ill health. Normally, when the old age people will have some people will have the death anxiety also. Good people, good health people will have some death anxiety also. That is the last one. So ultimately, the counselings by psychologists will help a lot for elder people to come out from their mental health issues. Any questions? Any questions?
No, sir.
No, sir.
Thank you. Suppose mental health, mental illness, if they don't do, family members didn't observe the elder people, what they are feeling, what they are suffering, if the family members didn't observe, so the elderly people problems will increase further. So how they become, how their feelings, how they act, if undiagnosed, the elderly people conditions, definitely their behaviors will change. How their behaviors are impacting. You see, just withdrawal from social activities like meeting people, going on outings, and insomnia. People, they don't sleep properly. When their psychological condition is not happy, they don't sleep properly. Intense sense of guilt most of the time. Nobody is bothering about me. Nobody is understanding my difficulties. If the person is sensing like that, he feels guilty. Guilty feeling also will depress the people. And loss of interest in pleasurable things which they earlier liked to enjoy or doing. The depressed elderly people, earlier they are enjoying looking TV or playing some carom board, discussing with their grandchildren or playing with grandchildren. This type of interest also they will lose because of their depressive symptoms. Feeling of hopelessness and worthlessness. They feel there is no hope for my happiness, there is no hope for my future. Just I am living. I don't have any worthy conditions. That is the reason people are not identifying. Next condition, increased confusions. Naturally, because of the elderly people, some memory problems will come. They will have some confusions. Neglecting personal care, grooming, bathing, and clothing. Earlier, how they are dressing, how they are grooming, They have become very careless people. Constant worry of the unknown future to such an extent that affect their daily function. Now I am like this. In future, how I will be. Constantly worrying about their future. Some elderly people frequently they complain about pain in different parts. Many people are observing this condition. Those who are having some elderly people in the house. And frequent accidents and irritation, agitation, leading to anger outbursts. Normally, the elderly people will lose some patience. For small issues also, they will become anger. They will shout. They will outburst. So all these things are happening because of their mental health is not happy. So as a psychologist, you should provide proper counseling and make them feel happy by counseling to family members and for the elderly people also. How you counsel? So in which situation, which type of counseling is required is another factor that we have to learn. We have to practice. We have to undergo some training with an experienced person. Counseling is also not so easy. We have to learn a lot of techniques in counseling. Okay. And while there is increasing prevalence of mental illness among older adults, access to mental health services is very limited. Generally, when they become older people, mental health services taking is very less. They don't go to proper professional. Even family members also don't show much interest. He has become older man now. He will behave like that only. Why he require all these services? We are also having problem. He is a aged person. Normally aged people will behave like this only. In that intention, even some family members, even they don't allow to go to a professional, or they don't take him also to a professional. This is very normal. Casually they will take. But here the family members needs counseling and guidance. Number of barriers also, like denial problems. Even family members, if they say, daddy, your memory is you are losing, you are not remembering, lot of things you are missing. Even if they say also, the elderly people simply they deny. No, I am perfectly all right. You are only having problems. I don't have any problems. But even though they are in denial mode, but it's a responsibility of family members to have a consultation with a mental health professional and find out the reasons why he is suffering, and attending all his concerns definitely will make him happy. Okay, we are going to next topic. If anything, anybody want to discuss?
No, sir. It's clearly explained.
Thank you. Now, the old age people, how is their cognitive conditions, we are going to discuss. I am discussing from your book only, I am saying, but with my experience also, I am joining something in these topics. That's all. Here, cognitive disorders. Cognitive means thinking, perceiving things, and problem solving skills,
Behavior.
Memory.
all these things comes under cognitive activities. But cognitively, the elder people will have some problems. What are the problems? Those problems we are going to discuss now. Cognitive disorders in elderly people involve disturbances in thinking or memory that represent a marked change from the individual's prior level of functioning. See, the elderly people functioning earlier days is different. Now it is different in their cognitive functions because of some old age effect and degeneration effect in the brain also. In that, there are three types of cognitive disorders we are going to discuss. First one is delirium. Second one is amnesia. Third one is dementia. All three related to cognitive things only. But many people, indisciplined people in life, they are going to invite this type of disorders. But definitely with these conditions, even family members also will have some suffering. So we should try to follow the good lifestyle to avoid this type of cognitive disorders for everybody. At least as a psychologist, we are going to get some awareness how these cognitive disorders will affect the personal functioning. Then we can able to at least follow ourselves and help to family members and others also. Very important. The first cognitive disorder is delirium. Delirium conditions, how it will be. Delirium is a serious change in mental abilities. Serious change in mental abilities. It results in confused thinking and a lack of awareness of someone's surroundings. The disorder usually comes on fast within hours and a few days. The delirium condition people, the cognitive disturbances will not continuous. Today, his cognitive condition may be suddenly change, and tomorrow it may be all right. Again, after some days, some disorder thinking he may start again. Delirium can often be traced to one or more factors. Factors may include a severe or long illness or an imbalance in the body, such as low sodium. These are all medical conditions. The disorder also may be caused by certain medicines, infection, surgery, alcohol, drug use, and withdrawal. So, particularly the alcohol consumers. Nowadays, it has become, for many people, it has become a habit, taking alcohol. But different people interests are different. Some people are taking to come out from their daily stress. Some people are just taking alcohol for having social company. But anything, the alcohol will have some effect on the brain. It will reduce its activity. Or drugs, particularly nowadays, we are all seeing so many, these drugs are catching by police nowadays, particularly these youth people. Instead of alcohol, many people are now using drugs. But these are all things will have effect on the brain. Ultimately, thinking power, problem solving skills, awareness, and memory, all these things will get effect in early age. And withdrawal. Anybody is having withdrawal symptoms means how it will affect. When a person taking very frequently alcohol or drugs, because of some problem in the family or doctor advice, if they stop taking alcohol or drug usage, definitely they will have some withdrawal symptoms. That is the reason even doctors also advise not to stop suddenly any activity. Reduce the dosage. Reduce the alcohol consumption, the quantity and the frequency. Slowly, we have to adapt to our body the reduction conditions also. Otherwise, the withdrawal symptoms will come. Those things are very severe. The cravings will dominate our control. The people will take more consumptions of alcohol because of withdrawal symptoms. This is also happening, particularly in drug addiction centers. They are very highly controlled when they are in drug addiction centers. When they come out from drug addiction centers, 50% people are again going back to drugs and alcohol. Because in drug addiction center, they can maintain the condition when they come out in the environment, in the society. But society, they cannot control. Again, society will make them to influence to have again those habits.
Excellent, sir.
Hmm.
Sir, what are the withdrawal symptoms like?
Withdrawal symptoms are very serious. Even we are all observing in society also, particularly, I will explain one thing. During Corona period, the KCR government stopped all this toddy, kallu. You remember?
Yes.
Yes. That time, what happened, you know?
Yes.
The Yarragadda hospital totally full. People behavior changed a lot because they are all habituated daily taking of the toddy. Because the toddy is not original again. It is a chemical. So body already got adjusted for that chemical. If they stop that chemical suddenly to the body is not accepting. So their mental conditions have changed. Their behaviors have changed. See, people will get tremors, shaking, and they are unable to think anything, irritations, anger, doing some wrong things. So this is the one example for withdrawal symptoms. So anything suddenly happen because body adapted to certain chemical. If the chemical dosage is not there in the body, definitely some changes will come in our mental condition.
Okay, thank you, sir.
So we are discussing delirium. Delirium symptoms, how it will be. Symptoms of delirium usually begin over a few hours or a few days. They typically occur with a medical problem. Symptoms often come and go during the day. There may be periods of no symptoms. Symptoms tend to be worse at night when it's dark and things look less familiar. Because this delirium symptom is confusions, particularly confusions. Ultimately, it is coming from mind only, all these things, brain only. Some changes in brain activities because of degeneration. The old age people will have some confusions. Today, they behave in one way, tomorrow they say they deny it. But it is not continuous process. Only few days they behave like this, or few hours they behave like that. Remaining time they are good again. So the symptoms in detail we are going. The delirium symptoms, how? The primary symptoms include the following: reduced awareness of surroundings, trouble focusing on a topic or changing topics. Suppose when we are discussing something, they will discuss other thing. That is the reason, the changing topics. Getting stuck on an idea rather than responding to questions. Being easily distracted. Those people will get being easily distracted. Being withdrawn with little or no activity or little response to surroundings. This is reduced awareness of surroundings. And next, poor thinking skills. Poor memory, such as forgetting recent events, not knowing where they are, who they are. The orientation problems also develop in delirium. Trouble with speech or recalling words. Rambling or nonsense speech. Trouble understanding speech. Trouble reading and writing. And behavior problems in particularly delirium conditions. Behavioral and emotional changes. Anxiety, fear, distrust of others. They don't trust others. Depressive symptoms, a short temper or anger, a sense of feeling elated, lack of interest and emotion. So here we are discussing, one is reduced awareness of surroundings, poor thinking skills, and behavior and emotional changes. So ultimately, the family members are responsible. Any changes in elderly people, they have to take care first. Otherwise, psychologists don't know all these things, no? Until unless they approach us. When to see a doctor? If a relative, friend, or someone in your care shows symptoms of delirium, talk to the person's healthcare provider. Your inputs about symptoms, typical thinking, usual abilities will be important for a diagnosis. It also can help the provider find the causes of the disorder. When we are, as a family member, when we can provide full information about the person, because the delirium person cannot provide all the details. As a caretaker, as a family member, we have to provide all the details of the elderly people, how they are behaving, how they are thinking. Then only the medical professional will get proper diagnosis. Then only he can provide proper treatment. Clear? Now the delirium topic completed.
Okay, sir.
And next one is the old age people, elderly people will have another memory related condition is amnestic disorder. That is amnesia. The first one is delirium. Second one is amnesia disorders. The third one is dementia. Now we are going to discuss amnesia.
ఎక్కడున్నాయి బాబు వేసుకోకుండా అయిపోయింది ఇంకా పాలకు కట్టుకోవాలంటే
అమ్మా మీరు మాట్లాడకూడదమ్మా, మీరు మ్యూట్ కావాలి. Okay. Amnesia is a serious memory loss. It can be a symptom of other conditions or happen by self. Amnesia involves being unable to remember significant events or details from your life. Amnesia means, particularly its name is forgetting things, not remembering things, or recent things, or even past life things also. They will forget. This is also a brain related condition. All the memory problems will happen because of some problem in the brain or brain degeneration, physically degenerations. And there are two main forms of amnesia. Retrograde amnesia.
Sir?
Please.
Both are similar words, both are different. Delirium and amnesia.
See, delirium will create confusion. Amnesia is a forgetfulness. Confusion means something is there, but by seeing it, you are getting confused. But here, in amnesia, you are forgetting. Totally, you are not getting memory. You are not remembering. The past things are present. Recent happened things. Yesterday, what happened? Today morning, what tiffin you ate? Where you have gone yesterday? Memory loss. Recent memory loss. Short-term memory loss.
Okay.
Understood, Amma? Delirium will have memory. In delirium, memory is there, but it is creating confusions. But in amnesia, memory loss is there. Here, there are two types of amnesia. Retrograde amnesia is when you can't recall memories from your past. Past things you cannot memorize. That is called retrograde amnesia. And another condition is anterograde amnesia, is when you can't form new memories but can still remember things from before you developed this amnesia. The recent informations he cannot memorize. The recent happenings. Immediately half an hour before or 1 hour before, things he cannot memorize. There are two types. Normally, if anybody met with an accident, some head injury, or some brain stroke happened, for those people also, this amnesia problems will come. For brain stroke people, they lose memory, the long, particularly retrograde amnesia. Some people lose the memory items, anterograde conditions. So
Yes,
the head please.
Sir, can we call it as coma, sir? Coma is come under coma. If they injured, sir, if they met with an accident, they will go into coma, no, sir.
Yes.
కోమాలోకి వెళ్ళిపోయిందని చెప్తూ ఉంటారు కదా సార్.
కోమాలకు వెళ్తారు because why they are
అంటే
going
వాళ్ళు
into
మెమొరీ లాస్ అయిపోతారు కదా.
Okay. Coma means no, there is no consciousness. Okay. Their brain is not functioning properly. Why they are going into coma is the blood circulation sufficiently not going to the brain. The blood goes to brain properly. The blood is carrying not only blood, oxygen it is carrying to the brain. When the oxygen going to brain, the brain functioning will be normal. So in stroke people, what happened? Stroke means some obstruction, some blood clotting in the passage of blood flow to the brain. So sufficient quantity or maximum quantity of blood is not going to the brain means the oxygen deficiency happening to the brain. The brain functioning will get effect because of lack of oxygen. This we call apoxia. So once brain is getting affected, which area is getting affected? Particular brain, there are different functioning areas. Vision area, auditory area, memory area, thinking area. So which area is getting more affected? That function will get effect even after recovery from the coma. Understood?
Okay, sir. Okay, sir. Okay, sir.
Okay. Next, how is the symptoms of amnesia? Changes in your ability to remember events and things that happened to you. Whatever happened to you earlier days or recent days, the changes will come in memories. Difficulty recalling names and faces. And in your real life also, sometimes if you see suddenly somebody, you cannot recollect the name. What is his name? Sometimes it will happen. Not remembering locations and how to get to them. Some people, the locations, they cannot locate properly, and how to go there also sometimes they forget. Forgetting about upcoming events that you plan to attend. Many people are nowadays forgetting because they are depending only on phone book. What is our program next 1 week, where we have to go, but they don't remember because of amnesia. And people with amnesia may also experience something called confabulation. The amnesia people will experience the confabulation. What is confabulation? You understood now. This is when your brain automatically tries to fill in memory details and makes a mistake. An example of confabulation would be misremembering what day an event happened on recently, or the details of an event from your past. Here, confabulation example will come, you will understood. People who have confabulation believe their memory is genuine and accurate. They did not intend to lie or deceive. It's just an error that happens without their knowledge. Ordinarily, confabulation is harmless, but it can become a bigger issue and maybe something you notice when memory loss is more severe. This is called confabulation. So this type of condition also will happen when people are having amnestic conditions. The third condition, dementia. Dementia is one type of Alzheimer's. So the dementia is not a specific disease, but is rather a general term for the impaired ability to remember, think, or make decisions that interfere with doing everyday activities. Dementia is a very long process. It won't happen suddenly. Slowly. It is very long process. It will take some years to become serious. Alzheimer's also. In the initial periods, the memory loss is very minimum. It is a progressive disease. There is no remedy for this. The disease is getting progressive. That means today you are not remembering few things. After 5 years, the percentage of memory loss will increase. After 10 years, further it will increase. One day, total memory will lose. Total brain will get degenerative. So dementia is a very progressive and long days happens for this. It won't happen suddenly. So dementia mostly affects older adults. It is not part of normal aging. Dementia is not part of a normal aging. That means good healthy people, when they become even 90 years also, dementia will not come for some people until unless their brain physical structure has some deformities, some problem, the dementia starts, brain degenerations. Causes. Dementia is caused by damage to or loss of nerve cells and their connections in the brain. The symptoms depend on the area of the brain that's damaged. Dementia can affect people differently. Here also some symptoms are there. Okay, we will discuss in our next class. Now our class will end at next 6 minutes. So I want to have some interaction with the students. So whatever we discussed today about the elderly people, mental health conditions, their memory problems, what type of problems they face in elderly age, and we started discussing the cognitive deficits in elderly people. The first condition is delirium. The second condition is amnesia. The third condition is Dementia.
Dementia.
Yes, we are all discussed these things, and the further material we will discuss next Saturday. And I am very happy to teach you. And there another 5 minutes is there.
Thank
If
you.
any interaction, if you want to have, please, you are invited.
Okay, sir. Thank you, sir.
Sir,
Please.
Thank
sir,
you,
in
sir.
anterograde amnesia, that memory loss will happen. Means they not remember the faces after, before amnesia or after amnesia, sir.
Anterograde means recent, short term, within before half an hour, before 1 day. Those things they don't remember.
Means, sir, after they remember, sir, means they forget that day.
Forget. Suppose yesterday somebody has gone to some place. Okay, na? We will ask him where you have gone yesterday. He don't remember.
Okay, sir.
Morning, what you taken tiffin? They don't remember. I forgotten what I eat in the morning. Okay, I will try to remember. That type of things will come for them.
Then what, sir? What is retrograde amnesia, sir?
Retrograde means 5 years before what happened, where you are, where you studied. Okay. Those areas, there is a lot of effect in memory.
Sir, antegrade means prospective. Now present condition.
Yes, present condition.
So retrograde means retrospective. Before that.
Yes. Before and not yesterday. Some.
Yes.
Last.
Some past.
Yes, past life.
Yes, sir.
Sir, small children, about 5th class, 6th class students, they urinate when they sleep. How to overcome that, sir?
Okay,
पूछी ना रही already. मैं पूछे सोच पूछती. दूसरे क्या कर तो पूछूंगा.
We have to try to reduce their anxiety, because of anxiety conditions only people will urinate when they are bedwetting. So better to take to the children to a professional, a psychologist. Definitely it will get cured. Here the problem is, even though family members are knowing, they are simply neglecting. They are not giving much importance how to avoid this type of behaviors in the children. And ultimately they are punishing the children also. Because it is not the problem of the child. He is not awareing all these things. Accidentally it is happening. But it is parental responsibility not to punish the children, take to the professional, provide some help to the children.
Excuse me, sir. Dementia affected people, again they will recover, sir, from that. Is it possible to recover?
No, sir. Dementia is a very serious condition. Dementia people are mostly they are dependents. They will become dependent on somebody. It is a progressive disorder, I am saying, no?
Okay, sir. We should give support.
Year by year, the conditions will deteriorate. It is a progressive. Once it progresses to severe level, they need definitely support, personal attention completely.
They're always dependent.
Yes, they don't know whether they are wearing dress or not.
Okay, severe.
What type of condition will come? Alzheimer's is very, very problematic condition. But one thing, we are all lifestyle, these are all lifestyle problems. Whatever we like, we are doing in this age. But what effect it will have on our brain, nobody is having that awareness.
Okay, thank you.
Sir, consciousness is a part of brain or it's something else?
Which one?
Consciousness.
Consciousness is related to brain only.
Related to brain, but some people think it's something different thing. It does not part of the brain.
It is not part of the brain. See, once I am saying, brain is a physical part. Okay. What is the thinking process is a physical part. You can't see thinking. Only you can see brain as a physical form.
So it's like a software.
Yes.
We cannot.
Brain is
Sir,
a hardware.
part of mind, right?
Yes.
Consciousness is part of mind.
Mind only. Mind you can't see.
Okay.
It is also a chemical change, no, sir?
Yes, yes.
Chemical changes are
Happening that we are not understanding all these things.
yes, sir.
When we are so active, when we are in younger ages, we are very careless about our future happenings. Okay, can we conclude class today? Already 3 o'clock. For next class, we have to give time now.
Okay, sir. Thank you, sir.
Okay. Thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, Thank you, sir.
Thank you, Amma. Totally 90 students joined. I am very happy.
Okay, sir.
Okay.
Yes, sir. Pleasure.
Okay. Thank you very much.
sir. Thank you, sir.
Thank you, sir. Thank you, sir.
Thank you.
Thank you very much, sir.
Yesterday, somebody kept the class video in the group. Who has kept? Recorded the class and they kept in the group.
Okay, sir. We follow, sir.
No. Without university permission, you cannot keep in the group.
Okay, sir.
Okay, because the other faculty also will feel bad. Why somebody is putting all in the group, somebody is not putting. Correct, no?
All subjects should be uploaded.
Then it is okay. But I don't know the conditions of university.
Yes, sir.
Yesterday I have seen in the group, somebody has posted the video, total class.
Because
Sir, it's also useful for other students, those who have not participated in the class.
Correct. But what about other students will think differently, no?
no, sir, we
Sir meant the university should upload and they will upload the online classes videos.
Okay. Positive thing only.
Sir,
We
can
have
you
to
share
think
the
first.
PPT please in the group?
No, without university permission, I cannot share. Because I am discussing whatever material is available in your textbook only, I am discussing. Out of textbook, I have not prepared anything.
We have another unofficial group, I think. There you can send, right?
I may share in privately, but not in a official this thing. Okay, I am concluding today. Thank you very much for participating in my class.
thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, sir.
Thank you.